Hi, I'm Dr. Gayathri, physician Changampally Remedium. We have Dr. Vismaya, an Ayurvedic surgeon, Changampally Remedium with us. Today, we are having a discussion on multiple myeloma, which is one of the most prevalent cancers of this time. So, starting off with the discussion, what is multiple myeloma, doctor?
Okay, so we have plasma cells in our blood, which are a type of WBCs. Monoclonal plasma cells are abnormal plasma cells which proliferate in abundance in the bone marrow, and it results in multiple myeloma. And it can also result in hematopoietic cell demission, that is, the blood forming cells will not function properly. So, that is multiple myeloma as such, if we have to explain it.
Okay, doctor. So, what are the clinical presentation or the signs and symptoms also in association with the present case scenario we are discussing on?
Okay, clinical manifestations of multiple myeloma are very diverse. It can start with simple weakness and malaise, or it could be bone pain, fracture as such, anemia or bleeding, renal dysfunction, or the calcium in the blood may be raised, or the patient may have increased susceptibility to infections.
Okay, doctor. So, in this case, in this particular case, what were the treatment modalities or the Ayurvedic approach we have chosen?
Okay, the treatment basically in Ayurvedic point of view concentrates on Rakta Shuddhi. Okay, that is blood purification methods. Along with that, diet and regimens and pain management, because the patient will have severe pain and most probably will be on 2 or 3 analgesics, and associated psychological weakness, we can say as such. So, managing all these will be the primary line of treatment. Along with that, we need to make sure that supportive therapy after the primary line of treatment will be maintaining the bodily tissues in a healthy state. Whether these primary and the next line of treatment should go simultaneously or one after the other depends on the clinical presentation we see in the patient.
Okay. So, doctor, as you have already mentioned, the first line treatment is Rakta Shuddhi in this particular case. So, what exactly is the importance of Rakta Shuddhi here?
Okay, in Ayurveda, especially from the surgical point of view, Rakta is of prime importance. Its correction or its purification, with that we are expecting an effect in the entire body in patients of multiple myeloma and also in the pain management. And we can adopt various types of methods such as Virechana or other oral medications which can bring about Rakta Shuddhi. That all depends on the case.
So, doctor, can you give can you cite an experience from your side that you may have dealt with many cases of multiple myeloma at the hospital, right? So, can you cite an experience of yours at the hospital?
One I recall which came to us recently was a female patient, age 53. She had a history of severe pain in both the bilateral lower limbs. Okay, that was the presentation which the patient had first. Then, with course of time, she developed severe pain in low back associated with burning sensation. Okay, on examination in nearby allopathic hospital, she was diagnosed as a case of multiple myeloma, and as a support to the spine, she underwent surgery followed by some 13 doses of chemo as well as radiotherapy, and again there was a recurrence of the same. So, for further management, she consulted us. At the time of consultation, the patient's complaints were severe pain in the back as well as in both the lower limbs, associated with severe tiredness and constipation. Okay. Along with that, the patient was mentally very disturbed, and we admitted her and we started the treatment. And at the time, she was on three analgesics. Okay. Along with morphine, she was under 2 or 3 analgesics. So, the immediate response what we got from her was in 3 days. Within 3 days, we were able to reduce the analgesics to 1, and the patient was able to sleep. The appetite became proper, and she was passing motions. Okay. Now, what we are expecting is after a course of 20 days or 21 days, we want to do the blood test to see what are the changes in kappa and Lambda.
Lambda.
Okay.
Okay, doctor. So, what was the actual outcome or the result of the patients that you have dealt with?
See, from treatment point of view, it's very satisfactory, and from lab or investigative point of view, we still require a little bit more time to assess it.
What is the actual outcome or the result you have noticed with the patients you have dealt with?
Okay, immediate outcome is significant symptomatic relief. Along with that, the overall health and the disease as such, the progression, we can deal successfully.
Okay, doctor. So I think we actually had a comprehensive discussion on multiple myeloma. So the viewers have been having a small idea at least about the case. So I think this would have been helpful. So thank you so much, doctor.
Thank you.